Ava, how are you?
Good, how are you?
Good. So thank you for providing me with all of the information to do your nutritional counseling. I put together a little PowerPoint here to kind of show you where you're at and some recommendations we can make. So you're 32 years old, 5'4", and 169 pounds.
Correct.
You do have high blood pressure, which is controlled with medication. Your activity level is high. You work out 5 days a week. And you had ortho treatment in the past, and you're happy with your smile.
Yep.
Okay. You're not a smoker or a drinker.
Nope.
And then we did talk about you wanting to lose weight, and you already kind of implemented a diet and cut your calories, and you're working on upping your activity level, which is great. So I'm just going to go over some of your calories and your vitamin and mineral deficiencies. After calculating with your energy level, your recommended calorie intake is about 2,500 calories, but that's to maintain your weight. And we talked about you wanting to lose weight. So my plate recommends about 2,000 calories a day, but that's usually about if you want to lose a pound a week, and since you want to lose 1.5 pounds, we're going to aim for that 1,700 to 1,800 calorie range, and that's kind of where you're already at, so that's great. Your BMI should be between a 19 and 25. You're at 29, so that is considered overweight, but obviously you're already working on that, so again, that's great. So your average calorie intake for the 3 days is about 1,757.7. So again, that kind of falls in line with your goals. So with the total calories, there's some kind of percentages you want to keep in mind. So for your carbs, you want to be between 55 and 60%. Your protein 10 and 35%, and then your fat 30%. So you're a little low on your carbs at 41.3%. Your protein is at 24%, which is within the range, and then your fat is a little high at 34.3%.
Okay.
So just keep in mind, high amounts of fat can lead to weight gain and risk of obesity, and then just obesity-related conditions like heart disease and diabetes.
Okay.
Your vitamin and mineral intake, you are low on your calcium and your iron. Your vitamin A and your vitamin C are good. Just keep in mind that you're not severely deficient, so I'm not super worried about it, but with calcium, if you continue to be deficient in that, it is important for your bone and teeth structures. So just keeping in mind, that could lead to bone problems like osteoporosis. And then iron can lead to anemia and things like that. So your food group analysis, this is kind of what my plate recommends for you to eat daily, which I have here for you. So you should be having 1.5 cups of fruit, 2.5 cups of vegetables, 6 ounces of grains, 5 ounces of protein, and 3 cups of dairy. So you do fall short on your dairy and your vegetable. Your grains, technically you fall short, but 2 of the days you were meeting the correct amount. Just that 3rd day put the average off just a little bit. And then just an additional note that I wanted to talk about was your sodium and your cholesterol. So I have that here. If you look at these red areas here, so your sodium was pretty high on the 1st day, again on the 2nd day, and then just a little elevated on the 3rd day. And then your cholesterol, again, was high there, again on the 2nd day, and then again on the 3rd day. So both sodium and cholesterol, having high levels can contribute to heart problems, and since you do already have high blood pressure, it's just something to be aware of. Maybe lower some of that intake so you don't have any chances of your condition worsening. So we also look at the caries risk and decay promoting potential. So your caries risk was low. based on one day of your diet. You're not consuming a ton of sugary or acidic foods, and when you do, they're more than 20 minutes apart, so that's great. And you also talked about how you drink a lot of water, so that's good. But the foods that you are eating, which would be in the decay promoting potential area, that it was a little high at the 15. So that puts you in the watch out zone. So just keep in mind, when you're eating those foods, just continue. I know you do brush twice a day and floss, so just keep doing what you're doing so that you don't get any cavities. So I did put together some recommendations for you, but I just wanted to ask, do you like yogurt?
I do.
And spinach and celery?
Mm-hmm.
Okay, great. So some of my recommendations would be, so during breakfast you do typically eat 2 eggs, and then at lunch you eat, it looks like about 6 ounces of chicken nuggets. So since you are meeting your protein, you're more than meeting your protein, some of the recommendations I could make is to take away maybe some of the eggs, and maybe substitute it for yogurt. That would help you meet your calcium intake and then help you with your dairy intake daily. And then the chicken nuggets, maybe just cutting that in half or lessening it to help with your sodium and cholesterol intake, or substituting it for like turkey or unbreaded chicken would be a good idea. And then just another snack that you could implement is celery, because that has calcium in it along with other nutrients. And then it looks like sometimes you do eat salad for lunch, so maybe just substituting half of the lettuce for spinach. That would help with some of your iron intake. So yeah, is that something you think that you could do?
Yeah.
Great. Do you have any questions for me on this plan?
Nope.
Okay, so I have this My Plate plan that I'll send you home with, and then I will also send you over the PowerPoint that I put together just so that you can keep in mind some of the concerns we talked about so that you don't forget.
Okay. Thanks.
Well, thank you for allowing me to do nutritional counseling on you.
Yeah, thank you.